Best.
And according to the CDC, approximately 30 million Americans have diabetes. It's a chronic condition that occurs when the body does not properly produce the hormone insulin.
Type 2 diabetes is the most common type, accounting for up to 95% of all diagnosed adult diabetes cases in the U.S. People with diabetes are 2 to 4 times more likely to develop cardiovascular disease than people without diabetes, with devastating possible consequences. Clinical pharmacist Heather Free says Americans should become more familiar with an underutilized but available resource that's ready to help.
Pharmacists have a wealth of information that they can provide to their patients to help manage their diabetes, such as when to take their medication, how to take their medication, if there's any drug-drug interactions, what's safe, what's not safe, even as simple as to diet and how to use their blood glucose meters.
Now, in addition to pharmacists, the little clinic at King Soopers can also help you manage diabetes and improve your condition with some lifestyle changes.
That's right. Here to tell us how, we have Liane Dupuis. She's a nurse practitioner with the little clinic. It's so good to have you back here, Liane.
Thank you for having me.
You know, we talk a little bit about type 1 and type 2, but so many people actually are in the stage of pre-diabetes. Tell us a little bit more about that.
Yeah, actually, it's a little over 84 million Americans have what's considered pre-diabetes, which is where your blood sugar runs higher than normal, but not high enough to be diagnosed with diabetes.
So that's also getting into danger, though, right?
Yes, absolutely, because you're headed down that road to diabetes usually. So that's a good time to start changing some lifestyle things. So that, yeah.
So are certain people more likely to be diagnosed than others?
Yes, I mean anyone can have prediabetes, but we see it more in people over 45, overweight, people who are overweight, and people who are sedentary and don't exercise.
Okay, so if someone's falling into that category, maybe they've been told by their doctor, hey, you're pre-diabetic, or maybe they're just taking their own glucose levels and seeing this kind of high, what are the best things they can do for themselves to get that regulated?
One of the biggest things is actually exercise, even if it's just a short 5 to 10 minute walk a day. But yeah, exercise lowers blood sugar dramatically.
Yeah, I remember I had gestational diabetes, and I would prick my finger before my workouts, and after my workout, it came down like 30 points. I mean, it makes a huge difference. I don't think people realize that, but it is true. So if people are facing this, what can they do? I mean, should people come in to do a test to see if they're diabetic, if they suspect that they have it?
If you're concerned, yeah, definitely come in. At the little clinic, we can do some lab work to see if you're diabetic or pre-diabetic. So.
Okay.
Okay, I think, you know, a lot of us, you know, at one time in the day, you know, or more times in the day, you can get very stressed out, you know, and does the stress really affect it more than diet and exercise, or are they all about equal?
It definitely as much. Stress definitely lowers or raises your blood sugar. So to do things to lower that, you know, breathing techniques, exercise, anything to reduce your stress will help lower your blood sugar.
Okay. For people who are sedentary, we have, it's Fitness Friday. We always tell people, you know, get off the couch. But sometimes those big workouts can be really intimidating. So why don't you walk people through, whoever's sedentary out there, how they can start maybe doing 3 times a week?
Yes. What we're looking for, our ultimate goal is 5 times a week for 30 minutes. But you can start out with 3 times a week for 30 minutes, or even 5 times a week for 5 to 10 minutes, and then every week add on a few minutes. If you have any medical conditions, though, make sure you consult your healthcare provider before starting exercise.
What should they be doing? Is walking enough?
Walking, light walking. It is.
Okay.
And even if you can't get in 30 minutes at once, you can break it up into 3 10-minute segments throughout the day of just light walking.
That's okay if you break it up. Okay, that's good to know.
So November is National Diabetic Month, so we're really getting the word out there for pre-diabetics, type 1s, type 2s. My niece and nephew are type 1s. They each contracted it around the age of 6, and now they're in their early 20s.
Oh, wow.
And they've done a pretty good job of regulating, but I remember in their teen years, it got tougher.
It is tougher for teens.
I don't know if it's because of the hormones, or maybe they're a little more rebellious and not doing things correctly, but teenagers specifically need to pay attention.
Definitely, and monitor those blood sugars and know what to do if you have low or high blood sugar and how to manage that. That's very important.
Right. And can you, at the little clinic, really kind of walk people through the basics, the fundamentals?
Absolutely, absolutely. How to check your blood sugar, what to do if it's high or low. We can order labs if we need, talk about nutrition, exercise, smoking cessation, because that does also play a part in diabetes.
Interesting.
Yeah,
So,
it's amazing all the new technologies that has come out, you know, as far as the pumps and everything like that. But it's still back to the fundamentals, the exercise, the diet, reducing stress. Thank you so much.
You're welcome.
I appreciate it.
And the Little Clinic healthcare clinics are located inside select King Soopers stores and open 7 days a week, including evenings. Board-certified nurse practitioners can treat the entire family, ages 12 months and up, for common illnesses like cold and flu, as well as provide preventive health services like screenings, sports physicals, and vaccinations. You can find the nearest clinic online at thelittleclinic.com. Well, still up ahead on this Fitness Friday, we're going to meet ultra